Home medical equipment and adaptive aids. There's a lot of things that are available to you at home if there's anything that you are recovering from or suffering from, including edema and other ailments. We're at Bluff Medical Center and we're learning a little bit more about that. My guests will include Jen O'Loughlin, Home Medical Equipment and Supplies Manager at Phillips Health Mart Pharmacy, and Lori Zobel, Registered Polysomnographic Technologist, fancy for sleep tech, and registered respiratory therapist. From the Bluff Medical Center here in Mauston, I'm Justin Riley, and this is Wisconsin Doctors. Welcome back to Wisconsin Doctors. We're here at Bluff Medical Center, and I've got a great team of folks with me today. This is Lori Zobel and Jen O'Loughlin. Welcome.
Thank you for having us.
We've got some stuff on the table today, which I'm really excited about. I'm excited to learn about what this is. We're talking home medical equipment. But first, Jen, I know that you work over at Phillips Health Mart Pharmacy, which has been part of the Bluff team since 2016. Give us a little bit of an overview of some of the products and services offered there.
We offer several things, from ambulation aids such as walkers and wheelchairs and canes, all the way up to hospital beds, Cpaps and Bipaps, and nebulizer units. Okay, so a wide variety of things there. And one of the things you offer, obviously, is Cpap and Bipap machines, as you mentioned, which we have here on the table. I'm assuming that's what this is. That's right.
And I definitely want to talk more about that, but first let's talk sleep, because that's kind of the whole reason why we have Cpap and Bipap machines. Sleep is important and not everybody gets enough of it. So Lori, Bluff has an awesome sleep lab. Tell us a little bit more about it.
We have a great sleep lab here at Bluff. We have a 2-bedroom sleep lab, and we offer full range of different types of services. And we do diagnostic studies and therapeutic studies, and we're open 3 nights a week.
Wow. So you have a lot going on over there.
We do.
Keep busy. So I'm just curious to know, how does somebody qualify for a sleep study? If they want to do a sleep study, how do people typically qualify for that?
Well, they have to see have a referral to see a sleep specialist.
Sure.
And we have 2 great doctors here at Bluff. We have Dr. Buss and Dr. Catter.
Okay.
Dr. Dan, who's here.
Sure.
And they both see patients, and they would refer to the sleep center if they needed to have a sleep study done.
Okay, cool. And that's kind of how you would qualify for having insurance cover it, as well as making sure that you get that referral.
Sure. They would do a prior authorization to make sure that the patient met criteria to come to our sleep center.
Sure, absolutely. Okay, so let's talk Cpap and Bipap. Give us a demonstration, or can you at least kind of walk us through how these work, and more importantly, how exactly do they help people who have some of the sleep issues that we talked about?
Sure, the Cpap is a really easy unit to have. These are the newer units. Excuse me, Justin.
No problem.
But these are very easy. So you'll see we have a couple different masks that we use.
Okay.
This would be the full face mask, and they come in they come in different sizes, from extra small to large.
So I understand this is kind of like a smart machine. It kind of understands when it's been disconnected and so forth.
That's right. So one of the neat things about this too, not only does it start automatically once you breathe, it actually stops automatically as well. So once you disconnect this, if you have to use the bathroom, you can just leave the mask on as is and go ahead, use the bathroom, and when you come back, go ahead and start that back up. Take a couple deep breaths, and it starts right back for you.
Okay.
So it's kind of neat. That way you don't have to fumble around with the machine at night. You don't have to fumble around with the mask at night. You set it at night when you go to bed, and when you wake up in the morning, you take it right off, and it'll actually turn itself right off.
Awesome.
The other good thing about these machines is they actually have an option on here, so you can actually see your sleep and how long this machine's been used, and the humidity level. Now you can only, with all this air coming at your face and breathing in, you're going to get a little dry. So one of the good things is there's actually humidity port on here. So this is the water chamber.
Oh wow, okay.
And the neat thing about this machine here is a ResMed S10, and this one is very easy to use. Now, a lot of people at home maybe don't know, but inside of here, this used to be a closed off unit, so it was hard to keep it clean. These units you can flip right open, so you can actually wipe it right down. Distilled water only in here helps prolong the life of the machine.
Yeah, absolutely. We just have a couple seconds left, but I'm just curious to know, are these machines for everybody?
Not necessarily. Well, they really do work 95% of the time to completely control sleep apnea. And some people may have some issues, but they do need to be sometimes desensitized to the mask to get over and get used and comfortable with it. And between the home care company and ourselves and the physician, we work all together to try to make that process happen and have the patient be compliant with their mask.
Awesome.
Some alternative mechanisms may be, surgical intervention, oral appliances, but they're not always covered by insurance. So the Cpap mask is the less invasive product and is 95% effective.
We got to take a short break. When we come back, we're going to switch gears. We're going to talk about post-mastectomy care and also lymphedema garments. We'll be right back here at Mile Bluff Medical Center. We're back here at Mile Bluff Medical Center in Mauston, and we're talking about some of the home medical equipment and adaptive aids that are available to patients. And I'm sitting here with Jen O'Loughlin. We talked about that before the show started. Talk to us a little bit about the post-mastectomy care you provide for patients.
Sure. So a lot of times when women are diagnosed with breast cancer, they either opt for or have no other option than to have a radical mastectomy, either bilaterally or unilaterally. And when that happens, a lot of times they're not aware that there is care for that. So what we have is specialized garments that can actually help make you more symmetrical. So if you lose one breast, we actually have some forms that we use. They come in many different sizes, and we use these in coordination with these mastectomy bras, which actually have pockets in them. So what we do then is we actually would measure you and add the form in there, which holds it securely, and it does a real good job of leveling you out and making you more symmetrical. So we do our best to make sure that we can make you feel as natural as possible.
And you and I were talking yesterday about how so many women don't even know that these types of solutions exist.
That's true.
And do they need to go through their doctor to get access to this, or can they come straight to you? How does that all work?
Well, both. If we do have a prescription for it, there are ways that we can help get this covered under insurance, which these are quite expensive items, so it's always the best way to do that. It's the best to get these under the insurance. But if for some reason you'd like to just come into the pharmacy and meet with me, I'm happy to do so too, and we can talk over your options.
Yeah, at least look at the options.
That's right.
Let's talk a little bit about lymphedema garments. This is something that's kind of a new topic to me. First of all, let's talk a little bit about what lymphedema is and how do these garments help people with lymphedema?
Sure. Lymphedema is swelling of really any part of your body. So we can actually have swelling of the legs, of the arms, really anywhere. So we offer several varieties of compression garments, which is one of the ways that we can treat lymphedema. So these garments are kind of hard to get on and off, but what they do, the purpose is to put them here on first thing in the morning. You put them on and leave them on all day. That's supposed to help prevent any additional swelling or edema. Also helps compress and get some of that fluid out of there.
Sure, so it can actually reduce swelling a little bit as well.
That's right, we have them both for ready to wear on the shelf for the legs, and we also have them for the arms and the hands.
Excellent, excellent. And I understand, I mean, you mentioned that these are a challenge to put on. Is there anything that patients can utilize that will help them do it independently?
Absolutely, right. So independence is key. There are several different things. We have one of these here. There's a couple different varieties of them, from soft or rigid, and then there's also one that it's a metal frame. We can order that. We don't actually carry it in. But how these work is patients that have a hard time bending over to get these on, you can actually put these up on waist level and put these on like this. And I told you it's kind of a struggle.
Sure, yeah. Yeah,
But
doing it up here is much easier than doing it down here,
right.
for sure. So.
Once you get that on, you actually just push this down to your foot and then just pull it up, and it'll actually come right on for you. So it's kind of a neat way to put that on.
Wow, wow. Well, we're going to take a short break here. When we come back, we're going to continue talking about some of the things that are offered. We're going to talk specifically about home medical equipment and some more adaptive aids when we come back right here at Mile Bluff Medical Center with Wisconsin doctors. So stick around. Welcome back to Wisconsin Doctors. We're here at Mile Bluff Medical Center learning about some home medical equipment that you can have access to, or maybe someone that you know. And we're talking specifically about home medical equipment and adaptive aids in this segment. So let's talk first about home medical equipment. Obviously, you weren't able to bring some of these things into the studio with you today, but we can definitely show some pictures. You have a variety of equipment to help patients while at home. Can you give us some examples of some home medical equipment you offer at Phillips?
Sure. We offer several different things, from hospital beds and wheelchairs, walkers, canes, bedside commodes, and bath equipment to help patients with their independence in the bathroom.
Yeah. Absolutely, and you also have some adaptive aids here, I see. I'm kind of excited to see, especially these things here.
Right. So we have a lot of patients that need and require some assistance while eating. Well, our goal is to help you have some independence while doing that. So a lot of the patients have tremors, whether it be from Parkinson's or from injury, but these swivel spoons then, you can see me kind of moving this here, and it allows the fork to stay pretty steady.
Yeah.
So it helps prevent all of the spilling.
Right,
so the patient actually has more control over the utensil. We also have the scoop part of this bowl. So how that works is for patients that really can't scoop here, they use the side of the bowl to scoop up.
Sure.
And again, this just really helps patients with their independence so they can actually, help themselves at home. And that really is the key.
Yeah, trying to get people to be as independent for as long as possible.
Absolutely, right.
Yeah.
Right.
So, I'm just kind of curious to know, are all of these products, you mentioned tremors, things like that. Are these designed with specific ailments in mind, or are they designed for a variety of different ailments?
I think they're just for everybody. Anybody that can really benefit from these, regardless of the reason. The ultimate goal is independence.
Sure.
So it really doesn't matter what you're coming for, as long as you have the ability to have your independence. That's what our goal is.
Absolutely. I'm curious to know, are these things that are covered, can these be covered by insurance?
Unfortunately not, but these are really low cost items.
Yeah, I was looking at some of the
carry
price points.
Yeah, we have them all in the pharmacy.
Okay.
Again, we have also, this is called a Nosey Cup.
Okay.
And that's for patients that really kind of struggle with drinking themselves. So this actually that has a cutout here to help when you're drinking to allow for the nose.
Sure, sure. I think it's just so fascinating how much stuff that is available that I just never even knew was available. And because, obviously, if you've never experienced it, you just don't know.
That's
you just
right.
don't know what's out there. But there's a lot of things that can really help people with their independence. What would you say is the most common thing that people are asking for when they come into the pharmacy?
We see so many different people. There's always such a wide variety. It
hard
really
to pinpoint that.
It's so hard to pinpoint one thing over another. We do a lot of specialized services there, such as the lymphedema, the post-mastectomy, and the diabetic shoes, though.
I'm curious to know also, what are people most surprised about when they come to find, because a lot of people probably walk in and they don't know some of these things exist. What are people most surprised to find that exists?
Right, that's a great question. We have something called a cane tip adapter, which actually fits right onto the bottom of a cane. It has some prongs on there that helps prevent slipping in the ice and the snow.
Wow, good for here in Wisconsin.
Absolutely,
sure.
right.
Yeah. That could be, I think anybody could use that, really.
For sure, especially winter in Wisconsin, right?
Yeah, absolutely. Well, we got to take a short break. When we come back, we're going to talk about diabetic shoes and inserts. Don't go away. There's more Wisconsin Doctors coming up after the break. back here at Mile Bluff Medical Center, and we're learning about some home medical equipment and adaptive aids that people can use. And actually now we're talking about diabetic shoes and inserts. So I'm really curious to know about this. First of all, why diabetic shoes? I mean, what's the difference between diabetic shoes and regular shoes?
Sure, that's a great question. So diabetic shoes actually allow a little more space in the toe box for a little extra area.
Sure.
The biggest difference between diabetic shoes and regular shoes are these heat molded inserts.
Oh, wow,
so
okay.
these inserts, while they look ordinary,
Sure.
we actually apply a heat source to them. And what I end up doing then is having the patient step directly on them after I apply the heat source.
Okay.
And then we heat mold them directly to apply that arch support for the
Sure.
patient. And we actually have the toe imprints too. And what that does with that is it prevents the slipping and the sliding of the foot in the shoe,
Sure.
thereby preventing callus buildup or possible ulcerations.
Okay, excellent. So it literally you heat that up, and then that makes it more malleable, and then when people step on it, it
Right.
cools, and it cools in place.
Absolutely. And then it's specifically heat molded for that patient's foot. Everybody's a little bit different.
Yeah.
So this is genuinely just for that patient.
Sure, sure. And you've got different styles I see here.
I do. So diabetic shoes, when they first started years and years ago, there was only a couple styles available. Very medical, very, very plain. And due to the diabetic epidemic and how people are getting younger and younger now with the diabetes, they're actually coming out with some newer versions. So there are several different kinds. We have work boots.
Okay.
These come with or without steel toe,
Oh, wow,
which
okay.
is nice for people that work in factories. We also have accommodative shoes. So these shoes are great for people with foot deformities such as bunions or hammer toes. Also with edema. So you can see that these are extremely stretchy shoes.
Oh, sure, yeah.
So it's fantastic with people that really kind of struggle with the edema or trying to get shoes on.
Right, right.
There's also another variety of shoe that actually, even though this is an extra depth, there is a double depth shoe.
Okay.
So we have several patients that have quite a bit of swelling in their feet that can't get on an ordinary shoe.
Sure. And I can imagine that, if you do have edema in your feet probably aren't the same size from day to day either.
That's right,
and
right.
So, something that kind of conforms to your foot like this and can stretch if need to and then contract when it
Right.
needs to is probably helpful.
I had a patient once that hadn't had shoes on in about 9 years. And
Wow.
her daughter called and said, would you come and see if you could do something for her? And
Wow.
for the first time in 9 years, I was able to properly fit her with some diabetic shoes.
Wow.
Which is amazing because she could finally leave the house then after 9 years.
9 years,
yeah.
that's incredible.
Yeah.
So at what point, obviously, we don't want to wait 9 years, before we
Right.
decide maybe we should take a look at this. So at what point should someone consider getting diabetic shoes? I mean, how do they qualify?
I think it's important to speak to your doctor, your podiatrist, about the benefits and if you would qualify. So the first qualifying factor would you have to be diabetic in order for insurance to consider.
Yep.
After which you would have another qualifying diagnosis such as a foot deformity like
Sure.
bunions or hammer toes, pre-ulcerative calluses, poor circulation, all of those are qualifying factors.
So to get insurance to cover this, which you probably want, I'm guessing.
Absolutely.
You need to have those two qualifying things: diabetes and then some other. Kind
Another
of foot deformity.
qualifying,
Yep.
yeah.
Yep. So we just have about a minute left, but I'm curious to know: is there anything else you'd like to mention about Phillips Health Mart Pharmacy, since you guys are part of the Mile Bluff team here?
Sure, absolutely. Our ultimate goal is having patients convalesce at home instead of in the hospitals or the long-term care facilities. We have several adaptive aids and ways to make you comfortable at home. If we don't have it, we can definitely order it in for you.
Excellent. If you don't have it, they can order it. Well, Jen O'Laughlin, thank you so much for joining us today. I want to thank all of my guests and our viewers from all of us here at Mile Bluff Medical Center and Wisconsin's 57 Television. We invite you to live longer, live better. We'll see you next time.